Spinal stenosis is an orthopedic disease. Look at this X-ray myelogram findings. X-ray findings and CT, MRI findings. Look at this. Lumbar spine. Detail going on. Introduction. Spinal stenosis is a medical condition characterized by the narrowing of spaces within the spine, which can put pressure on the spinal cord and nerves. This condition primarily affects the elderly but can occur at any age due to various causes. The narrowing can occur in different regions of the spine, most commonly in the cervical, neck, and lumbar areas. Definition. Spinal stenosis refers to abnormal narrowing of the spinal canal or neural foramen, which leads to compression of the spinal cord or nerve roots. The condition can result in pain, numbness, muscle weakness, and other neurological symptoms. Types. 1. Cervical spinal stenosis. Narrowing occurs in the part of spine and the neck, which can compress the spinal cord. 2. Lumbar spinal stenosis. Narrowing occurs in the lower back, primarily affecting the nerve roots rather than the spinal cord itself. This is the most common type. 3. Thoracic spine stenosis. This rare type involves narrowing in the middle part of the spine. What are the causes? 1. Degenerative changes. Aging leads to the wear and tear of spinal components such as intravertebral disc, ligaments, and facet joints, leading to stenosis. 2. Herniated disc. Disc can protrude or rupture, pressing on the spinal cord or nerves. 3. Thickened ligaments. Ligaments in the spine may thicken and harden over time, reducing the space available for the nerves. 5. Spinal injuries. Trauma like accidents can dislocate or fracture vertebrae, leading to spinal stenosis. 5. Congenital spinal stenosis. Some people are born with narrow spinal canal. 6. Tumors. Abnormal growths within the spine can cause compression of the spinal cord or nerves. 7. Paget's disease of bone. This bone disease can cause abnormal bone growth, leading to spinal stenosis. Risk factors. 1. Age, most common in people over 50 due to degenerative changes. 2. Genetics, inherited conditions like achondroplasia can lead to spinal stenosis. 3. Spinal injuries, history of spinal injuries increase the risk. For arthritis, conditions like osteoarthritis and rheumatoid arthritis can contribute to spinal stenosis. 5. Previous spinal surgery can lead to scar tissues and post-surgical changes that narrow the spinal canal. Complications. 1. Chronic pain, persistent pain due to nerve compression. 2. Numbness and weakness in the limbs leads to difficulty walking or using the hands. 3. Bladder or bowel dysfunction. Severe cases may affect the nerves controlling these functions. 4. Paralysis. Rare but can occur if the spinal cord is significantly compressed. Pathophysiology. Spinal stenosis involves the narrowing of the spinal canal or neural foramen, leading to compression of the spinal cord or nerve roots. This compression disturbs the normal function of these structures, leading to pain, sensory disturbances, and motor deficits. The narrowing can result from degenerative changes such as hypertrophy of the facet joint, thickening of the ligamentum flavum, or disc hernia. The resulting nerve compression leading to ischemia, inflammation, and the development of symptoms. Below are the key steps in the pathophysiology of spinal stenosis. 1. Degenerative changes in the spine. Aging process has it joint hypertrophy, ligamentum flavum hypertrophy. 2. Structural narrowing of spinal canal or neural foramen, disc herniation, osteophyte formation, spondylolisthesis. Congenital factors. 3. Compression of neural structure, nerve root compression, spinal cord compression. 3. Disrupted neural function, ischemia, inflammation, neurological symptoms. 5. Progression and chronicity, chronic compression, adaptation and compensation. Signs and symptoms. 1. Pain, radiating pain in the neck, back, arms, or legs. Lumbar stenosis often causes leg pain. 2. Numbness or tingling in the arms, hand, leg, feet. 3. Weakness in the extremities, making it difficult to perform daily activities, or balance problems, difficulty walking or maintaining balance, especially with cervical stenosis. 5. Bladder or bowel dysfunction. In severe cases, loss of control over these functions may occur. Diagnosis. 1. Medical history and physical examination to assess the symptoms and neurological function. 2. Imaging studies. 1. X-ray to visualize bone structure and alignment. 2. MRI magnetic resonance imaging provides detailed images of spinal cord, disc and nerves. 3. CT scan computer tomography can show detailed bone images and any bony abnormalities. 4. Myelogram, an imaging test where a contrast dye is injected into the spinal column followed by a CT scan to better visualize the spinal cord and nerve roots. 5. Electro-diagnostic tests such as EMG to evaluate nerve functions. Nursing diagnosis. 1. Chronic pain related to nerve compression as evidenced by patient reported pain levels. 2. Impaired physical mobility related to pain and muscle weakness as evidenced by difficulty in ambulation. 3. Risk for impaired skin integrity related to decreased mobility. 4. Risk for falls related to muscle weakness and balance issues. 5. Anxiety related to chronic pain and potential disability. Management and treatment. Non-surgical management. 1. Medications. 2. Analgesics to relieve pain. 3. Non-steroidal anti-inflammatory drugs to reduce inflammation. Muscle relaxants for muscle spasms. Corticosteroid injections to reduce inflammation around the nerves. Physical therapy exercises to strengthen muscles and improve flexibility and balance. Activity modification, avoiding activities that exacerbate symptoms. Assistive devices, use of canes, walkers, braces to improve mobility and stability. Surgical management. 1. Laminostomy, removal of parts of vertebrae, laminae, to relieve pressure on the spinal cord or nerves. 2. Foraminotomy, widening of neural foramen to relieve nerve compression. 3. Spinal fusion, stabilization of spine by fusing two or more vertebrae together. 4. Interspinous process spaces, insertion of spaces to keep the vertebral apart, relieving nerve compression. Psychosocial medicine. One, emotional support, chronic pain and potential disability can lead to anxiety, depression and social isolation. Providing emotional support, counseling and patient education can improve psychological well-being. For patient education, teaching patients about the condition, treatment options and lifestyle modification can empower them to manage their condition effectively. 3. Support groups. Encouraging participation in support groups can provide patients with shared experiences and coping strategies. Prevention. 1. Regular exercise. Strengthening core muscles can provide better support for the spine. 2. Proper body mechanisms. Avoiding heavy lifting and using proper techniques when lifting objects. 3. Healthy weight. Maintaining a healthy weight to reduce stress on the spine or posture correction, ensuring good posture to avoid unnecessary stress on the spine. 5. Avoiding repetitive stress, limiting activities that cause repetitive stress on the spine. In conclusion, spinal stenosis is a common condition that can significantly impact quality of life. Early diagnosis and appropriate management are essential to reduce symptoms, improving mobility, and prevent complications. Both non-surgical and surgical treatment options are available depending on the severity of conditions. A comprehensive approach that includes medical, physical, and psychological care can help patients manage their symptoms and maintain their quality of life. Thank you. Have a good day.